Hello and welcome. I'm Allison Roberts and I'm with Catarina Albuquerque, the CEO of the Sanitation and Water for All partnership. Nice to meet you, Catarina. We're in Lisbon and we could hardly be in a more symbolic building. We're in the Mãe d'Água reservoir. We're floating in what is a part of the 18th century aqueduct system that brought pure water to the whole city for the first time, and in principle to all who lived here. Catarina, SWA's vision is water, sanitation and hygiene for all, everywhere and always. 1 year into the COVID-19 pandemic, how is this relevant for the health and wealth of the world?
Hi, and also very nice to meet you, Allison, and a pleasure to be here in such a symbolic place as you were saying, and so adequate to the discussion that we are going to have. It is important, it is crucial to get water, sanitation and hygiene, as you said, always, for everyone and everywhere, in particular in the context of COVID, because we know that to stop the spread of the virus, hand washing with soap, keeping good hygiene practices are fundamental. If you don't have water, if you don't have soap, you don't get there. So water, sanitation and hygiene, and I think COVID brought it to the limelight, are a key intervention, a key equalizer to keep people safe, of course, in parallel to other measures. However, during the last year, I had hoped that our moment of glory would come, that our minutes, 15 minutes or 15 months of fame would become very evident, because I hoped that finally politicians, decision makers would understand, yes, we need to quickly invest in the prevention instead of only thinking of the cure. You ask me, are we better off in terms of access to water, sanitation and hygiene than we were 1 year before? Not necessarily. I think that you still have, and I've seen it with some of our partner countries in SWA, I've been talking with the ministers responsible for water, sanitation and hygiene, and they have told me there were COVID national commissions put in place with different ministers represented around the table, and the ministers responsible for water and sanitation have often not been invited. You have health ministers, you have the prime minister, etc. So we still need to do a lot in terms of awareness raising, working on the political will and the sensitization of politicians to the importance of water, sanitation and hygiene. Let me just add one small thing. We are now, the global north is setting the agenda in terms of what we see in the news, right? And what do we see in the news? You turn on the TV and you see vaccine, vaccine, vaccine and vaccine. This is now what is happening in the global north. But in the global south, we know that it will take a long time to get the vaccine. So it is important that the media and the news are not only inundated by vaccines, it's also important, it's crucial, I would even say, that in those countries, in particular those countries where the universal vaccination of the population will still take time, months or years, that we continue to bring the message of prevention and the importance of investing in water, sanitation and hygiene.
So the COVID pandemic is a good example of the importance of joined-up government, as you mentioned. Beyond COVID, though, there are many challenges. What are the biggest challenges and the opportunities that you foresee when it comes to achieving universal access to water, sanitation and hygiene by 2030?
The opportunities are huge, and I will end with the opportunities to end on a positive note. The challenges are also immense. And why are they immense? They are immense because I think that the global community has had the courage in 2015 to come around the table. All heads of state and all heads of government of the United Nations came together in New York and agreed that that our levels of ambition will be very high, and we cannot accept anything below universal access to water, sanitation and hygiene. So all of a sudden, of course, the task is much bigger, much more demanding than it was before under the previous development agenda. So we know that we have over 2 billion people without access to safe water and 4 billion people without access to adequate sanitation. So of course, it's huge. And we are not investing sufficient finance in the sector. We are not investing enough, national governments, but also international financing institutions, bilateral donors, etc. We need to put more money. But I would say, in a nutshell, that we need more political will. More political will. This is actually where I should have started. If we had political will in every single country of the world, the problems would have been dealt with, surmounted. That's number one. And we need, obviously, as I was saying, more finance, but we also need better systems in place, good governance. And of course, when I talk about good governance, this will benefit not only the water sector, it will benefit any of the other sustainable development goals, everything in society, having good accountability mechanism, judicial systems, ensuring participation, transparency, the fight against corruption, good policies, good laws, and independent regulation. So this is, in my opinion, what is key to make sure that we realize these human rights for all. Another important dimension is the topic of inequalities, putting the furthest behind first. And up until now, and let me tell you a story, those most marginalized have been forgotten. And it is also true that under the previous Global Development Agenda, the Millennium Development Goals, the goals determined that we would reduce by 50% those without access. What does it mean? That it was acceptable to leave the other half behind. Now with the Sustainable Development Goals, things change dramatically, and basically we need to stop, we need to end inequalities in order to achieve universal access. And of course, this, let me tell you a story, this implies a total mind shift, a different way of working at the national level, also at the global level. Let me give you an example. I visit an African country, I will not tell you the name, and I was talking with a minister who told me about the access rates to water and sanitation in that country, which were amazing, according to the minister. I then start visiting the country. Many informal settlements, people in rural areas, in poor housing, in poor dwellings, etc. And I start putting together the numbers. And I said, it doesn't add up. At the end of my mission, I talk again with the minister and I said, Mr. Minister, it doesn't add up. And he tells me, oh, but you are counting those in the slums. But they are illegal, they don't count. So this is, of course, as shocking as it is, it means that this is the way in which many countries, many governments are working, simply closing their eyes, ignoring the situation of these people. And a huge shift that we need, and it's a challenge, obviously, it's to acknowledge that these people exist. Go look for them. Who are they? What is the color of their skin? What language do they speak? Which passport do they hold? Do they have any disability? What is their age? What is their sex? So asking all these questions will be crucial in order to ensure sanitation, water, and hygiene for all. And I think that the opportunities are huge because I think there is growing, even if before I was saying we are not yet there, we are not yet there. But one of the things that I see we are doing at Sanitation and Water for All, it's bringing people around the table and making sure that we create a spark to lighten up political will. During the COVID period, well, we are still in the COVID period, 1 year ago, we did a Global Leaders Call to Action that was signed by 77 heads of state, CEOs, UN leaders, etc., in order to push the agenda up. Right? We bring ministers of finance around the table. We did it last year in 3 regional finance ministers meeting. We bring sector ministers around the table. And the idea is to spark that interest, to ignite the interest, the passion, and the realization that investing in water, sanitation, and hygiene is investing in everything, in global development.
On that point, there are so many urgent needs, from education to climate change to gender empowerment. Why should governments and development partners prioritise water, sanitation and hygiene?
Look, I am not saying that I'm not advocating. You will never hear me advocating for put everything in water, forget the rest. Of course not. It is, however, true that water is an underlying determinant, for example, for health. But also, let me tell you another story. I remember being in Senegal, visiting a school, talking with the girls, who told me, while we are menstruating, we stay at home, we don't come to school. I met girls in Kenya telling me exactly the same. Fantastic girls telling me, when I'm a grown-up, I want to be the president of Kenya. Fantastic girls who could not go to school while they were menstruating. Why not? They didn't have sanitary pads, they didn't have toilets in school where they could change themselves, etc. So also, they could not wash themselves. They didn't have sex-segregated toilets independently now of menstruation. They didn't have sex-segregated toilets in school. So how could they attend school? I met a father in Slovenia who belonged to the Roma community. And he told me in tears that they lived in a settlement, in a Roma settlement, no access to water, no access to sanitation, nothing. And one day, his daughter came home. She was a teenager, around 15 years of age. She arrived home crying and saying, I don't want to go back to school. And the father asked, why not? And she said, because the kids are teasing me because I stink. And the father told me, of course she stinks. We don't have access to water at home. She cannot take a shower. And I asked the father, what did you do? And he said, I hugged her and I cried with her, and the girl stopped going to school. So this shows us how fundamental it is to invest in water, because there is a domino effect. You invest in water, you are empowering girls. You are allowing women. I met fantastic women in Bangladesh living in an informal settlement that put together a hygiene club. And they started sewing sanitary pads to allow them to go to work while they were menstruating. So it empowers women, it creates more wealth, it allows for education, it enables health. Let me give you an example regarding health. I was talking with somebody who was telling me about the fact that many hospitals are only ready for male doctors. So they don't have sex-segregated toilets, they have the toilets for the male doctors. So if there are only toilets for male doctors, female doctors don't want to go and work there because they don't want to share the same toilet with the men. And what does this mean? That women are much less likely to go to those hospitals because they feel ashamed of exposing their bodies to men, to the male doctors. So you see the impact this has on women's health?
Back in 2010, the United Nations General Assembly explicitly recognized the human right to water and sanitation and acknowledged that clean drinking water and sanitation are essential to the realization of human rights. What has been the impact of that decision?
The impact of the recognition has been, obviously, there was a bit of symbolism in recognizing it. And when I talk about water, often people ask me, but how come that the Universal Declaration of Human Rights, how come that the main human rights treaties of the UN didn't recognize water and sanitation as rights in 1948, in 1966? It doesn't make sense. So I think it was a correction of a historical mistake. So that was important. It was also important because it had a catalytic effect in terms of giving the topic more visibility, in terms of the Sustainable Development Goals and the Global Development Agenda. We got a self-standing goal for water, sanitation and hygiene, which didn't exist in the previous development agenda. I know that it was, because I lobbied a lot for this goal, that there was a clear link between the recognition of the right and the inclusion of a self-standing goal. So the bigger visibility to the sector at the global level, but also at the national level. I've talked about Slovenia and about the Roma population. Slovenia integrated, felt compelled to integrate the right to water and sanitation into their national constitution. And it was a knock-on effect of the recognition. Furthermore, you see more and more national case law, national court decisions referring to the recognition of the right. It also created this realization among people, among governments, among everyone, that realizing these rights, bringing water to everyone, always and everywhere, is not an option, it's a legal obligation. So I think it really changes the discourse, and I've seen it when talking with people. I remember very clearly talking with a man in the Kibera informal settlement in Kenya, in Nairobi, and him saying, now that it is a human right, I can claim it. And you should have seen the pride of that man saying it is a right, and I have that right.
We talked about governance and now about the obligations of governments. Accountability is a human rights principle that permeates the Sustainable Development Goals agenda. So how can accountability and good governance lead to universal water, sanitation and hygiene?
So let me start with accountability. Accountability, I already mentioned it a little bit when I talked about that amazing man I met. But accountability empowers people. It empowers people. The existence of accountability mechanisms at the national level, for example, okay, at the global level also it's important, on the regional level, but let's stay at the national level, having a place that you can go to complain when the water that you are drinking are causing your kids diarrhea, or is killing your neighbors, or is making people sick. Or having a place to complain when you realize, how is it possible that I'm devoting such a high percentage of my household income to water, sanitation and hygiene, which forces me to make impossible choices and choose between paying the water bill or the supermarket bill, the water bill or the pharmacy bill. So realizing that the human rights to water and sanitation are not an abstract concept. They entail concrete obligations in terms of ensuring quality, physical accessibility, affordability, etc., without any discrimination. This package, the human rights package, empowers people to hold their governments to account. And when I'm talking about accountability mechanisms that governments must ensure, well, I would say that the measure of last resort would be a court of law, but it can be other types of mechanisms, having a place where you can complain to an ombudsman, a Defensoria del Pueblo, as they have in Latin America, having an independent regulator, as we have here in Portugal, having a place, an institution that is impartial, that will look at your situation, at your complaint, and understand, is this person not enjoying the right. So I think this is very important, but I've been only now talking about this relationship between governments and people. But of course we know that the world is not only composed of people and governments. There are many other stakeholders, many other players. The type of institutions that we bring around the table at SWA, academic institutions, the private sector, civil society, bilateral donors, international finance institutions, UN agencies, etc. And what we do at SWA is that we say we need to all be around the table. We work better, slower, it's true, but better and in a more sustainable manner if we come all together around the table. And we put in place a mechanism that we call of mutual accountability, where we have the government leading, obviously, because the government, as I was saying before, has the legal obligation of realizing the rights. The heads of state and the heads of government that sign up to the Sustainable Development Goals in New York in 2015. But we bring, so the government says, these are my priorities, this is what I commit to doing in the coming 2-3 years. And then we have the other players around the table saying, I will support you on that priority by doing research, by collecting data, by training people. So you have this national compact of mutual accountability among the different actors. I believe that this is an immensely powerful tool that can help us advance this agenda. Now, in terms of good governance is a tricky thing. We know that it's fundamental, right? It's like the roots under a tree, but you don't see them. You cannot take pictures of it, right? It's harder to sell. It's much easier to sell a tap, a toilet, a latrine, right? A pipe, because you see it, you touch it, you take a picture, you inaugurate it. How do you inaugurate good governance? How can you take a picture of good governance, right? So it makes things harder, but I would say that the good governance is the enabling environment that is indispensable for the rest to flourish, for the rest to be sustainable and to work. What I'm talking about what we were saying in terms of accountability, having the institutions that can hold the government to account, but also having good laws, having good policies, having good mechanisms in place to curb corruption, to ensure integrity, to ensure meaningful participation, etc., etc., etc. And this is part of the difficulties that I face in my day-to-day life, because at SWA we focus much more on these underlying elements, the enabling environment, the roots of the tree, right? And we try to work with governments. We do work with governments. We work with governments and other development actors in sensitizing everyone to the crucial importance of making sure that these building blocks are in place, because without them, who will want to invest in water, sanitation and hygiene? Who will make sure that things really work? Can I tell you another example? I visited once a Pacific Island state. And I saw that in that country, I saw a building by the ocean. Of course, everything over there is by the ocean. So I saw and I asked, what is this? And I was told, this is a desalination plant that was built. We got a loan to build it, but it doesn't work. It doesn't work because the electricity costs are too high. So we cannot afford to pay it. We don't have spare parts for when something is broken. And we also don't have anyone skilled to maintain it, to operate it, and to fix small problems. So now it's abandoned. Of course, I thought that this was a bad example, and I thought, but now they have learned something. I go and talk with the minister and ask, Mr. Minister, the ministers I'm referring to, they seem to be all men. Mr. Minister, so what is the solution and your vision to bring sustainable water to the country? And he told me that he had made a loan to purchase 8 further desalination plants. And then I asked myself, how was this decision made? Was it the minister by himself getting the loan? Or was there a participatory process? Is there a policy in the country, a proper policy, a proper strategy? Were there any calculations made regarding the price of electricity and how you can transfer some of those costs to the population under tariffs and a tariff policy? And I know that the answers to all these questions were no, 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 no. So the enabling environment, having the good governance in place is fundamental. I'm not accusing that minister of corruption, but who knows whether there was corruption? We don't know, because the decision was made by a man in an office in contact with external actors.
Thank you. Very complete answer. So, Catarina, going back to the people who were left behind, the poorest of the poor, how can we ensure that the poorest of the poor and other marginalized communities that you mentioned are not left behind in enjoying access to water, sanitation and hygiene in the future?
Look, as I said before, acknowledge their existence. That's the first step, right? Acknowledge their existence, bring them around the table. And this is why I am such a passionate and firmly convinced advocate of multi-stakeholder engagement at the national level. I think it's the aspirin, not against headaches, but against lack of transparency, exclusion, bad governance, etc. So bring them around the table, and make sure that their voices are heard and that they are truly able to influence decision making. Because if we know that they exist, if we know what their problems are, then we need to design national policies, national budgets that take that into account. Let me give you two examples. One regarding Brazil, which is some years ago in Brazil, the budget was structured in such a manner that the budget for water and sanitation, the federal budget for water and sanitation was structured in such a manner that there were more investments being made in the richest states of the country because there were more people living there. And there was a moment when there was a decision taken by the federal government to say, no, we are changing things, we are turning this upside down, and we are making a deliberate choice to invest more in those states that have the lowest coverage rates, to invert the situation and to bring the furthest behind, to put them first, to bring them up to standards and to make sure that they realize the rights to water and sanitation. The other story that I have to tell. I was again meeting with a minister in Bangladesh. Sometimes I say the country, sometimes I don't. In Bangladesh. And I was telling him, I visited many informal settlements, namely in Dhaka, in the capital city. And the situation was appalling. The bulldozers, I remember the people in the slums told me, we know with 1 week ahead that the bulldozers will come and will destroy our slum. And honestly, I thought this was so outrageous, I thought they were exaggerating, to be honest. So I go and I talk with the minister and I said, I was told 1 week, is this true? And the minister tells me, 1 week or less, right? And then I expressed my concern and told him, these people are living under your jurisdiction, and they have a human right to water, they have a human right to sanitation. They also, by the way, have the right to housing. And what he told me was that I didn't understand the national circumstances. I didn't understand the stress, the pressures that developing countries face when it comes, for example, to the situation in informal settlements. But I've also visited countries in the global south. Let me give you the example of Namibia, where there are still also informal settlements, but where the government is saying, let's de-densify the informal settlement in order to make sure that we can bring water, sanitation and hygiene to the people. I visited informal settlements, favelas in Rio de Janeiro in Brazil, where the government is bringing sewage to the community, water to the community. So it can be done, it can be done. It's a question of, again, political will, and it's also opening our eyes and not looking away from a problem in, I would say, every society, which is the problem of stigma and discrimination. We think, and I've seen it in every country that I visited, we see a divide between the them and the us, right? And we've seen in history how this has had such serious consequences for humankind. But this divide between the them and the us, the homeless who are lazy and us who are hardworking, those living in informal settlements also because they don't want to work or they are criminals, and us who live in a formal settlement. This divide, the stigma against certain parts of the population, gives legitimacy to the continuation of this situation where we still have margins, significant proportions of the population being left behind. I remember talking with a mayor in a country with a significant Roma population, and the mayor told me, I cannot be seen as investing in the Roma population, otherwise I will not be re-elected. So we need to face these issues, these political issues, we need to stop them, because without tackling these underlying taboos, we will never be able to reach the vision of universal access to water, sanitation and hygiene for all, always and everywhere.
Catarina, you do seem to be more of a natural optimist than a natural pessimist, but what is the state of play for Sanitation and Water for All, the partnership right now?
Look, the state of play, yes, I am an optimist. And why am I an optimist? I'm an optimist because I've seen problems, but I've seen solutions. I've seen lots of solutions. I've seen, with my own eyes, places, cities, states, countries, where, because there is political will, because there is this determination and this vision that yes, we can, yes, it is possible, yes, it is within reach, from heads of state, from heads of government, things dramatically change. I'm not saying that it's easy, so possible, so within reach. So I always say when people tell me, yes, this vision of getting water and sanitation to everyone by 2030, it's not realistic. Well, it's not realistic if you don't want to play your part, if you are not ready to give that step. I think it's realistic. I think it is totally possible. And what we are doing from our side at SWA, I talked about the spark. We are creating this spark in order to make sure that there is, because if we talk with politicians and with people, just with the boring and the grey numbers, which in my opinion are super powerful, we don't get there. We need to make people feel passionate about water, sanitation and hygiene. The politicians need to understand this is a good investment. It will make my people happy. Oh, and maybe they will even re-elect me because they realize that their girls are not raped at night when they are going out of the village to hide behind a bush to defecate, because they see that their women can go to work and there is more income in the family, because they can see that their children and even they are not sick of diarrhea constantly. So because they will see that they will be able to drink water from the tap directly without having to spend huge amounts of water, of money in filters, in bottled water, etc., etc. So I think that this is an area with a huge potential. I think we just need to ignite. So at SWA, realizing all of these challenges, but also all of these opportunities, what we have decided is, in terms of political will, that we need to reach up. We need to reach up to heads of state, heads of government, heads of international organizations, CEOs of the biggest companies, universities, etc., parliamentarians, ministers responsible for finance, for water, sanitation, health, you name them, education, climate. And then we need to reach out to other sectors, make sure that those working in other areas become the WASH champions. It's not us trying to convince them, it's them claiming also for water and sanitation, because they know that they cannot realize the right to health. It's impossible to achieve health for all if people still have diarrhea, if people are still suffering from other waterborne diseases. It's impossible to realize the right to education if girls cannot go to school because there are no sex-segregated toilets. So basically, we want to create this global movement in favor of water, sanitation and hygiene, not in detriment of the other development priorities, but rather to service also the other development priorities. They all go hand in hand, they are mutually reinforcing. We think that water and sanitation and hygiene are, however, pretty basic.
Catarina de Albuquerque, thank you for your time and thank you for watching.